That's probably as good as we're gonna get. Alright, let's get out of here. So I'm pretty excited. I just finished cleaning my car the other day and it is like smelling good. It's all like spick and span. It's pretty nice. I don't think I often clean my car. In fact, I don't know if I've cleaned this car at all for like 4 months. I put it on the back burner so much that I just don't do it. Anyways, it's good now that it's done. I should do it more, but I'm lazy. So anyways, let's go through an honest reflection of what medical school is like, because I'm sure people, well, I don't know if offers would be out just yet. I think they come out a little bit later on in the year, October or something like that. And people might want to know what it's actually like to do medical school in Australia, how it goes. Is it a good experience? Is it tricky? Is it tough? Is it impossible? Do you have to make all these different sacrifices? Who knows? Well, I do, because I've done it. Well, at least I know what my perspective of medical school is like. And it would have been different for a whole bunch of other people. I don't know why that guy just cut me off. Interesting. But I think, first of all, you have to realise that medical school is a whole different ball game compared to doing an undergraduate degree or whatever you were doing beforehand, because you're essentially getting all like the quote-unquote brightest people in the room. And I don't think they're the brightest people. I think they're just people who got like good grades and did well enough to get over whatever test or whatever entry thing that they had to do to get in. Sure, you have to have some level of intelligence, but to say that smart people cannot, to say that only smart people do medicine, I don't know if that's too much of a generalization, to be honest. But whatever you are, you've got into med school. There are people who are absolute gunners in there who will be the top surgeons or the top physicians and essentially just be really like dedicated and overachievers, are essentially what they are. And maybe someone would say that all people in medical school are overachievers to a certain extent. They are definitely like, you know, yeah, some people would be like quite like type A personality, highly strung, wanting to study all the time, doing really well on exams, and essentially just want to like improve and do things constantly. So I think if you're getting, well, I know for me, like I was getting okay grades in undergrad, and then the realizing factor is that like people in medical school just like, I think one perspective to understand is that maybe it's about readjusting your, not readjusting your expectations, but understanding that, say, if you got like an 85 and 90% in undergraduate, then that is not going to translate to an 85, 90 in medicine. It might translate to like a 75 or a 70, but you're going to have to work like extra hard to like do really well in med school and all those exams and everything. So understanding that, yeah, it's a bit more work to do well, and there's a lot more content to cover, and it is a different ball game is all I'm trying to say. I'm not saying that you can't do well, or just because, you know, you did well in undergrad. Well, actually I am saying just because you do well in undergrad doesn't mean you will do well in medical school. You still have to like work pretty hard and get the job done. Having said that, it is not all like doom and gloom, and I think med school is a really good way for you to figure out what you want to get out of medicine and essentially see the lay of the land. You know, you don't want to wall yourself off and just focus on one different specialty. It's a way to work out a lot of different things that might be interesting to you. And you learn about so many different things in med school. You get exposed to you know, public health, you know, you get statistics, all the different surgical specialties. You get guest lecturers to come in and they give, you know, all their talks on their area of expertise, their surgeries that they do. The physicians come in and they talk in depth about all the detailed pathophysiology, and it's really cool, but there is just so much on offer. It's easy to get overwhelmed. And I know once you start learning all the theory, that's one thing, but when you start going on placement in med school, that's a completely different thing as well. And I know for me, I thought as soon as I got into the hospital space, like, I know absolutely nothing, and there's so many different things out there that I have no idea about, and how am I going to spend all this time learning about everything? And you can't learn every specialty in the most amount of detail to an extent that you understand it and feel comfortable in it, but having like the bare bones framework of specialties, or of as many specialties as you can, is a really good starting point. I think when you understand something, then you get more interested in it, and then when that happens, then you sort of start to have like a domino effect in terms of your, you know, in terms of your ability to be engaged and stimulated by that area in medicine. So putting effort in will generally get you more enjoyment and fulfillment in med school. Wow, I just got sprayed by a puddle from a car driving the other side of the road. There's another one who got sprayed as well. Crazy. I think that's a good consideration, is that if you are feeling overwhelmed, that's okay, acknowledge it, but also realize that the answer is not to shy away and avoid, you know, work or just study. You know, put yourself out there and like expose yourself to as much as you can, you know, on clinical placement, in med school groups, and all these different things. Make sure you're getting as involved as you can. I think that's the one thing which everyone probably would say, is that they wish they did more and got involved as much as they could. And you know, you have all these awesome opportunities to, you know, to get involved in different groups or committees, or, you know, go to different surgeries, or be a part of different like clinics or something on your clinical rotation. You know, you might never see that again, and just to have that exposure is amazing. So that's a broad stroke view of like how to approach med school. But in terms of like the nitty gritty, I know each med school is slightly different structure to each other, and you know, some are 5 years, you might have a 6-year one, you might have a 4-year one, which is what I did because I did an undergraduate beforehand. So the structure, generally speaking, is year one is clinical, and year one is not clinical. What am I saying? Year one is theoretical. So you sort of stay at the university, do your lectures, do your tutorials, go to your, you know, your anatomy cadaver lab, and just do as much as you can in terms of like the theory of medicine. You have a lot of lectures per week. I think, what was it? Was it 8 or 9? No, probably like 12. Yeah, I want to say 12. It was definitely a lot of lectures per week that we got exposed to. So do those. You have your tutes as well, where you go through like different case-based discussions and you know, work out different patient presentations and problem solve for the week, and that's pretty good. You also have like clinical tutes where you learn how to do different examinations. Like, you know, one week might be cardiovascular examination, the next week might be, you know, how to do a knee exam or stuff like that. So you learn a whole lot real quick in your first year. Soak up as much as you can, like a big old sponge, because you're going to use that. You're going to use those frameworks to refer back to yeah, you'll refer back to those frameworks when you're in the hospital on an orthopedics rotation, needing to perform a knee exam on a post-operative patient, or a patient who might have sustained an injury to their knee and might potentially need surgery. So when you get into clinical placement, the doctors will assume that you know how to do a knee exam and know how to interpret the findings. Sure, you might have not seen all these different pathologies and maybe recognize it, but have a good idea about what you think might be going on. So I think that puts it into context more. Like, think about, whenever you learn something in med school, whether it be in your first year, your second year, your third year, whatever it is, think about how is this going to be useful for my clinical practice. And one of the biggest things, like one of the biggest learning points that really changed how you look at things, well, it definitely changed how I look at things, to be honest, is stop studying for your exams and start studying for your career. And when you take that approach, you really question, do you actually understand what the concept is? Can you explain that concept to a patient? Is it reproducible information or knowledge, or is it just some slab of text that you've remembered to regurgitate for an exam? When you stop studying for your exam like that, then I think you actually become, or start to, at least approach the idealistic model of a good doctor. And that's someone who actually understands the detailed medical stuff, but is able to put that into real life situations and see a patient who might have a medical condition that might be the one that you've learnt about in med school. Take that, understand how to convey that to the patient, what history questions to ask, what examination features to look for, what investigations to order, and then how to manage that patient. You are essentially going to be people who look after sick people. Yeah, but sick people come in like a variety of different forms, and you might have an elderly sick person who doesn't speak English, is from a different country and doesn't really understand where they are, might be very confused, and you need to navigate that space. And that might be very different to the patient who presents, who is essentially the same person as you are, the similar age, different life trajectory, and might be presenting with a substance overdose, or a mental health exacerbation, or some sort of psychotic episode. Being able to take yourself out of that point of view of your shoes and put yourself in the shoes of the patient, I think it's just a real skill. You won't learn how to do all those things in medical school, but you'll have to think about how to put it into perspective, and that's what I would encourage people to consider. Learn the basics, learn the fundamentals, and then as you start learning more and more, question, how is this knowledge going to be useful for your life as a doctor? That is arguably the most helpful piece of advice, because then you actually remember stuff in a way that is useful and reproducible and makes sense. So year one, theoretical. Year two might also be theoretical for some unis, but for us it was clinical. You also do get a bunch of clinical placements in your first year as a doctor. Some unis might have more placements than others. They might involve GP placements, maybe a couple of excursion type things to a hospital, and it might be pretty useful for you just to see how it looks, because some people might have not been in a hospital apart from visiting like family or friends who might have had an operation or been a little bit sick or unwell, or potentially even a grandparent who was a little bit sick. That's the only exposure you might have had to a hospital. So to see it from a doctor's point of view is certainly very, very helpful. And and gives you context to just how like a hospital actually looks, how it's structured, how it works. I don't know. I think it's like kind of tricky to, hold on, having someone just absolutely run through people. Madman on a mission. It's crazy. What are they doing? Just calm down, bro. Because I think the layout of the hospital is certainly confusing. Different wards, where people go, how patients go from the ED to the imaging department, to the ward, to the ICU, to the operating theatre and back, and then get discharged from home. And they might have like a discharge lounge or some sort of like transit lounge sort of thing. So lots of hospitals structured very differently. It's cool to know the layout and get exposed to that early. But yeah, so you might start to get into your clinical rotations in your second year. For that, when I say clinical rotations, you might not actually know what that means, but view yourself as a shadowing person for a particular unit or specialty. So say if you're in the emergency department, I would probably go and shadow like a registrar or a senior doctor. The junior doctors are probably just trying to keep their head afloat, trying to not drown, and they might not be the best learning people to go into the emergency department to shadow. It's good. It's a good idea to see what they get up to and how they go about things, but it might not be the best way to get your hands on and see procedures and do that sort of stuff. The senior clinicians or registrars might be good because if they're not busy and completely swamped, then they might actually have the time to teach and encourage you how to do things properly. And they might say, oh, this person's a really good respiratory exam. Go and do a respiratory exam, then come back and present your findings to me. And they might have already worked up the patient. That patient might be waiting for admission to a gen med ward and be on treatment for like, I don't know, community acquired pneumonia and need to come in for some IV antibiotics or something like that. And then you go and you do your full respiratory examination, you get practice with doing it, getting slick at it, and then presenting your findings. And I think that that's probably like the biggest thing to learn from medical school and clinical placement is, hey, I'm going to learn how to get really good at doing this one thing, so I'll know if someone has crackles in their left base, or I'll look for signs of like a pleural rub and be able to convey those signs to a colleague in like, less than 5 minutes. If you think about it in a bigger perspective, you might fast forward a couple years down the line, you're like the gen med reg on a particular hospital and you're in charge of accepting referrals for different patients. If you get asked to see a patient who comes in with like respiratory symptoms, then go and have a listen to their chest. If you don't know how to do that and then convey that to your senior consultant or someone to run the patient past you to see if they need to come into hospital or not, then yeah, I think you've just missed an opportunity there. So you're going to be saying to your boss in the future, this is a 79-year-old patient who has come in with 3 days of cough, fever, and some shortness of breath. She's a bit crackly on the left base. Her chest x-ray shows similar findings. I think she needs to come in for some IV antibiotics, along with some other, things in the story that would make you want to do that. And that's just all about learning how to synthesize your findings. And you can only synthesize stuff once you've got the basics and the fundamentals down pat. Yeah, so med school clinical placement is all about getting good at your fundamentals, taking a history, doing an exam, suggesting management plans and ordering investigations, and doing that under the supervision of a senior colleague who is actually looking after the person. It's honestly like a cheat code for putting all your medical knowledge in context, and you will see a patient with pneumonia, you'll see a patient who maybe has undergone, investigations to rule out a heart attack or not. And just having that experience and exposure is second to none in medical school. Obviously, more exposure is going to just make you a better clinician, and if that's your focus in medical school, I think that's a really good one. It's not the hardest thing in the world, as I said before, and a lot of people look at it like, oh, med school is this big thing. It's just the same thing as all these other things that you might study for or try to, specialize in a career for. You still got to put in the work. You still got to watch the lectures, do the tutes, practice your skills, everything like that. It's just in a medical context. That's it. In terms of, how I found it, it was pretty doable, I would say. I was not the best medical student out there. I didn't always get the best grades. I thought I was okay and I understood a bit, but I'm not going to spend 10 hours each day studying and, trying to get 100% on all these exams. I'll do what I can, try to get as much as I can out, but I'm not going to sacrifice everything else that I want to do or am interested in to just focus on one thing, which is med school. So I think that's just my mentality that I wanted to do, but at the same time, I wasn't just going to scrape by and do the bare minimum and not really be interested in things. I was genuinely interested in learning about the things that we were getting taught about, but I wasn't going to do 24/7 study to try and learn more about it. So yeah, I guess take it with a grain of salt, figure out what works for you in med school. Yeah, you start off doing your theory, you practice your exams, you learn all the pathophysiology of all the diseases, you learn about, different investigations, different clinical findings, all that sort of stuff, and then you transition into more of a placement hospital environment. That might, you might rotate through different specialties. You go through pediatrics and gynecology, and you go through, GP land as well. You might do a bit of emergency department, surgery, everything that you can get your hands on, just jump right in and get as active as you can. And then in the later parts of med school, you start to sort of transition to starting to work as a doctor, and you might draw your focus to more of a intern compared to a senior doctor, and you might start to realize what you want to focus on in terms of how to get the job done. So how to do an admission note, how to do a discharge summary, all these different things that you might need to actually learn how things actually work before you start becoming a doctor. And there's a real focus in the last few months of your med school journey where you actually get time to shadow interns specifically. And that's certainly what I found, and I think it really, really helped. So yeah, in a nutshell, med school was really cool. I really enjoyed it. Obviously, should have done more stuff and stayed later at hospitals and, gone to more surgeries and not focused on as much on exams. I think you'll probably get a good proportion of people saying that. Yeah, at the end of the day, they would rather see a cool operation or get to see a different pathology or hear about different symptoms from a patient or have a different clinical exam finding or do a different procedure. People would rather have that in their arsenal because exposure is key, experience is key. So if you had that versus getting a better mark on an exam, you're going to take the former all day. So that's what I would say. Put yourself in positions to really get as much experience and exposure as you can, because at the end of the day, that's what's going to make the difference. One of the other cool things, and if I'm ever working with a med student or see them around, one of the things I always tell them to do is shadow the on-call registrar. So, I mean, at the moment I'm all in surgery, so we rotate through an on-call roster, and that just means you get referrals and consultations from different specialties, whether it be ED or different specialties in medicine, and they want your advice or your opinion about certain things. So if you shadow that person, who's holding the phone, who's getting advice, who's getting phone calls, who's reviewing patients, admitting patients, all those things, that's when you'll get the most exposure and the most patient experience. So that's what I would say for any med student who's looking to get more involved, get more into it, go do that. Anyways, we're gonna leave it there, and I'll see you guys next time, but hopefully that gave you a bit of an honest reflection of what medical school was and how it sort of works. Okay, bye.